Welcome back. More news of the Saudi Southern African Development Community. SADC region is battling widespread cholera outbreaks that has seen schooling and health services impacted. Only 3 countries in the SADC have the capacity to deal with the waterborne disease. It came up during a meeting with SADC health ministers, Africa CDC and UNICEF on bolstering national multisectoral cholera preparedness and response efforts, strengthening regional collaboration and cross-border activities at large. Now, Dr. Paul Ngwakum, Regional Health Advisor for UNICEF Eastern and Southern Africa, joins us. A very good afternoon, Dr. Paul, and thank you for your time on the SABC at the South Coast, joining us live from Nairobi, Kenya.
Thank you very much for inviting me.
So, Dr. Paul, at this point, we understand that parts of the SADC region are said to be battling a cholera outbreak, and perhaps you could just take us through the severity of this outbreak as we speak. What is the data also reflecting?
I think it's a very serious situation, to say the least. Since early 2023 till now, early 2024, 8 SADC countries have battled or are still battling with cholera. And we've counted over 140,000 cases and over 1,300 deaths. We're talking about the DRC, Eswatini, Malawi, Mozambique, South Africa, Tanzania, Zambia, and Zimbabwe. And I think you may know, since the festive season, Zambia and Zimbabwe are experiencing an exponential rise in the number of cases, with geographical spread as well. We're talking about something like average of 1,000 cases per week and high mortality rate with high risk of cross-border transmission.
Well, Dr. Paul, speaking about the areas of concern at this point and even just capacity, the capacity of some of the countries, children are also often the most vulnerable in such situations. And how, at this point, do we, help them stay protected in this instance as we navigate on the go?
You're very right. Children are always vulnerable when you have infectious diseases. And in the case of cholera, because their immunity is still growing. If we take the case of Zambia, about 52% of the cases of the infections are among children less than 15 years. And since we're talking about SADC ministers of health, I think they had a discussion on how to ensure that there is systematic assessment of the drivers of this transmission among children with tailored interventions to be able to mitigate this transmission. There are issues around sensitization of parents to understand that children, when they have diarrhea, they have to seek for help, and this can be something like cholera. Another issue you may want to know is in the disadvantaged communities and disadvantaged neighborhoods, we always see these children playing in the streets, in water ponds, next to garbage cans, and these are places that they can easily get infected. You may think it's just an innocent play, but it can become lethal because of infection from cholera.
Well, you're speaking about interventions and strategies, and what does the role of border management authorities or coordination amongst, such border crossings do to help end or monitor or mitigate against the spreading of it?
I think, as you rightly say, cholera is a disease due to ingestion of food or water that is contaminated. The first thing is, I think the different authorities, meaning governments and the different stakeholders, have to ensure investment in long-term water services, especially for the disadvantaged communities, or what we call the hotspots. But we have other challenges which are a bit difficult to mitigate, which is climate change, changing weather patterns, bringing floods that cause a risk for cholera. We also have conflict in some of the areas, internal conflict, but this leads to displacement of populations, and this is fertile ground for transmission of cholera. But in essence, and now that we are faced with the outbreak, there are certain things that they have to do. Urgently provide water, which is portable at the point of collection, at the point of consumption for these at-risk populations. We need to do social behavior change, risk communication and community engagement so that they can know how to prevent themselves from getting cholera or seek for help. But we need supplies, we need trained and motivated staff that can take care of the cases that are affected. Another thing I just want to add is there is vaccination against cholera. The big challenge is globally we have stockpiles that are not enough for all the countries that need to be able to be served with vaccines. And now, instead of giving 2 doses, we have to give 1 dose. That will help to maybe stop the outbreak, but we need long-term investment because to have real immunity through vaccination, you need 2 doses.
Well, Dr. Paul, you actually, just took me to my next point because I wanted to understand how cholera epidemics occur in the context of climatic events that we've seen exacerbated over the past few years and the risks associated with that, just on the back of the tips that obviously you highlighted regarding access to safe water, sanitation, and even just community mobilization to educate and inform people better.
Yes, as I said, cholera exists.
Yeah.
And cholera can be aggravated by poor sanitary conditions. When you have changing weather patterns, when you have floods, what happens? Floods unearth disease, unearth infectious substances, and contaminate drinking water. And this becomes very serious, especially in a situation where the population didn't even have access to basic water, sanitation, and hygiene. And this gets aggravated by changing weather patterns, be it floods or even droughts. When there is lack of water, they go fetch water where they don't have potable water, and these are all sources of infection.
All right, we're going to leave the conversation then. Thank you for your time at this hour and for weighing in, Dr. Paul. Dr. Paul Ngwakum is a regional health advisor for UNICEF Eastern and Southern Africa, speaking about the cholera outbreak in SADC region. Just the reality on the ground, some of the measures that need to be put in place immediately, and as well as the tips to ensure that there is access to safe drinking water, sanitation, and also mobilizing the community to be better educated and informed as we continue to trying to fight this and mitigate against it spreading even further. And thank you to him for joining us at this hour.